Hi, today we are going to discuss about a very interesting topic about the human system, which is the biomechanics of knee. Knee is an important part of our body and it helps us in doing our day-to-day activity. We should keep appreciating about structures like this, which most of the time we don't realize its importance until we feel the pain. Yes, knee pain is a common complaint that comes with aging, with injury, with sports and so many other activities irrespective of the age too. So here in this video we will be discussing more on what is the structure of the knee, how it is enabling us to do our day-to-day activity and how to keep it healthy. Yes, so myself Mrs.Dhiviya Lakshmi, assistant professor in the Department of Biomedical Engineering, and I am just going to talk a few interesting concepts about the biomechanics of knee. Let's go into the lecture. Knee is a very important joint in our body and it is one of the more critical, complex, in contrast a weaker joint. Why it is critical? Because it helps in performing all weight bearing, load transferring, stability in lower body, both during standing and walking or any activity that we do. Knee becomes one of the most critical joint. Why we call it as a complex joint? Because it does more complex movements. Almost 3 pairs of motion are executed in the knee when we do our activity of standing, walking. They happens in a combination. So we will see in this lecture why we call it as a complex joint, how critical is this joint is, and we say it is a weaker joint. Why it is called as a weaker joint? Because it is prone to injury and the rate of injury is more high when this particular joint suffers any damage, like you suffer a fall, you slip down and fall with age, with sports, with any activity, then the joint which is most commonly injured is your knee joint. That is the reason why we call it as a weaker joint. And another aspect is it is the very simple joint. It is also contradictory because why we call it as a simple joint is in terms of the number of bones that are forming this joint. There are only 3 number of bones that forms this joint. One is your femur, second one is the tibia, and the third one is the patella. Yes, in the next slides we will see how it is arranged and how these 3 movements or 3 pairs of movements are possible and how it is all arranged in our body. So this slide shows the femur which forms the superior part of the knee joint. Any joint we normally say is when 2 bones come closer. Any joint is when 2 or 3 or more bones come closer. So your femur, with respect to your knee joint, your femur bone, it forms the superior part or superior bone to the knee joint, whereas the tibia, it forms the inferior part of your knee joint. So this image, what is shown here is a image of the femur bone, and what we would like to appreciate here is the distal portion of the femur bone forms the knee joint, and if we look closer into this, you can see the ends are not even, but it has an uneven shape. So this uneven shape, what we see here, it forms the condyle. With respect to the bone's major axis, take this as the major axis, the side towards the middle of our body is called as the median side, and the one to the other side opposite is the lateral side. So the condyle which is on the median side is called as the medial condyle, and the one which forms the lateral side is called as the lateral condyle, and the one you see here, there is a groove, there is a dip in the frontal plane of your femur. So that groove is to accommodate the patella. Patella here, it is the kneecap in common terminology. Yes. So the one which see in the left side is the anterior view of the femur, and the one in the right side shows the posterior view of the femur bone, and it is very beautifully shown here how the structure is arranged. This arrangement is completely for focusing in enhancing or promoting the articulation in a very smoother way, because this is a very complex joint with more number of movements, though it forms a hinge joint. The knee joint is one type of hinge joint. Hinge joint. Hinge joint, the degree of freedom for movement is limited in one particular axis, but there are combination of activities, movements are happening in your knee joint, which we will be appreciating in the next slides. So this particular slide shows us the information about the femur bone, how the condyle is arranged. The condyle to the median side is called as the medial condyle, the condyle to the lateral side is called as the lateral condyle, and we also see there is a groove in the anterior side of your femur. This groove is to accommodate the patella, which is the third bone of your knee joint. So this image shows here the tibia, which forms the second bone, of your knee joint. So this tibia is the bone which connects the femur to the foot. So this is playing a very major role in balancing, stabilizing, yes, and movement. Yes, the femur bone with its condyle structure is going to sit over, not directly, but it is having a space, that is why it is called as a joint. It is going to sit over the tibia, over the tibia tuberosity, and the femur condyle. With respect to that, the tibia is going to have some groovy structure to accommodate the condyle, and that groovy structures is called as the plateau. So the plateau towards the median side is called as the median plateau, and the plateau in the lateral side is called as the lateral plateau. Yes. So this is the very important information about the tibia, and we can see fibula which is connected to tibia, but it is not directly forming any joint. So knee joint don't have any activity that is contributed from your fibula. Fibula becomes an ancillary unit. It doesn't directly participate with the knee joints dynamics. The femur and tibia together forms the knee joint, and of course we have the patella here, patella which is going to sit here. This patella is going to go sit over the groove. So this is a beautiful image that is showing how the knee flexion has happened. It is showing knee flexion. So I kept telling you there are 3 pairs of movements are possible with your knee joint. So the first pair is flexion and extension. The image shown here shows the knee flexion. Flexion means bending. Flexion means bending of knee. When you do a squat, when you want to sit down, when you have to pick something from the ground, then you have to do knee flexion to do that bending activity. So flexion means bending, extension means straightening or stretching. See, when I want to stand still, I have to stand straight. Though what I do is my knee joint will be stretched. It has to be straight with the entire body axis. So that stretching and straightening is called as the extension. So they complement each other, flexion and extension. Second movement is abduction and adduction. So abduction, adduction is, we see when we are doing the stance and swing phase of the gait, the knee joint has to make certain internal adjustments in terms of displacement. So what is up means to moving away. Ad means to moving towards. When I want to stand still, there will be some amount of load that this joint will move like this. This is adduction. When adduction is happening, the other side of the joint, abduction will happen. Take, this is the anterior side, this is the posterior side. When I want to walk, when I want to do the extension, anterior side of your knee will experience adduction, posterior side of the knee will experience abduction. So this is the second set of movements, and the third set is rotation. It can be internal rotation and external rotation. It happens in a combination. When there is internal rotation is observed in your femur bone, when I want to walk, when I walk, there is a slight rotation in my femur bone inwards towards the median plane, and to complement that inward rotation that is observed in my femur bone, there is an outward or external rotation that is happening in your tibia, so that my landing, when I take one successive step, the landing becomes successful because of this internal rotation in your femur and external rotation in your tibia. So they complement each other. That is the reason why this joint is always called as a complex joint. Whenever I am doing an extension is your femur bone is like this and your tibia is like this, and you have the patella. This is the anterior view, this is the posterior view. So this patella, what happens is, this will just glide deeper into your femoral groove and prevent the extension of the knee and prevents the forward fall of the person. So it limits the forward hyperextension to be short. So the patella prevents forward hyperextension of your knee. Very important role of the patella. Yes, so we keep telling knee as a hinge joint. This is not simply a hinge joint, but it is a fibrous hinge joint. Because as such these three bones doesn't contribute, or they don't form one simple joint. It is a combination of the muscles, tendons and ligaments together. They wrap around these three bones, making it look like a bundle of fibers, and it is made up of fibrous tissue, fibrous rich tissues. Hence it is called as a fibrous hinge joint. So as mentioned here, the knee joint allows for the flexion of the leg, and it is a hinge joint that also does a bit of rolling, gliding and rotation. So I did tell you that combination of movements happens together when we do a simple activity with respect to movement. The three articulations is what is happening, because you have three bones and three different joints meets happens. One is the between the patella and the femur. I have shown that in the earlier slide, and between the lateral condyle and the lateral plateau of the tibia. Yes, we did mention discussed about the lateral condyle. Lateral condyle is a part of your femur bone, whereas lateral plateau is part of your tibia. Same goes with the medial condyle and the medial plateau. Yes, and as I mentioned earlier, fibula is not a part of your knee joint. So we will also see how this rolling, gliding and rotation is happening in our knee joint. So see, this is your femur and this is your tibia. We can see the median condyle, median plateau, lateral condyle and lateral plateau. Yes, to accommodate this condyle and plateau, there is a special structure called as the meniscus. Meniscus is nothing but a cushioning layer that is placed in between the bones, and this plays a very essential and inevitable role in transmitting the load from the upper body to the lower body, and this meniscus is just a pad of fat tissue, to mention it in a simple way. Brought a simple model from our lab. This is a model of the knee joint. You can see the femur here, this is the tibia, fibula, and you can see this is the patella, and it is totally connected with the fibrous patellofemoral ligaments and tendons. This is going to attach, this tendon, patellofemoral tendon is going to just fix the patella, the kneecap, to the femur and the tibia. So this forms essentially a wrapped structure, and what you see here in the blue color structure is nothing but the meniscus. So this meniscus is nothing but it is a fatty layer, which is a thick layer that sits over the plateau of your tibia, and they forms the articulating surface for the femur bone to happen over the tibia. So the entire movements all happening in this, the rotation, the gliding, the flexion, extension, everything is going to happen upon this particular surface, and this meniscus is very important for the load bearing property of your knee. And as mentioned, when we take the major axis, of the bone, we divide it as median plane and the lateral plane, and the meniscus which is present in the medial surface is called as the medial meniscus, and the meniscus which is forming in the lateral side of your tibia is called as the lateral meniscus. Structurally, surface area wise, it is different from media and the lateral. Medial meniscus are larger when compared to the lateral one, and it is also C-shaped, and it has got large surface area for articulation when compared to that of the lateral meniscus. Yes, so it is like a cup shaped cushion, and this helps in perfect fit for this particular joint. and it is supported by ligaments called as this meniscus are supported to the tibia through ligaments called as the coronary ligaments. It is attached to the tibia through the coronary ligaments. So this is the overall structure, knee anatomy, which is showing the main participants of the movements or gait. So you can see the femur bone, the patella, lateral plateau, medial condyle, and the entire structure. So this is your knee during the first spar of movement, which is the flexion and extension. So to perform this flexion and extension, ligaments plays a very important role in execution, because the knee has to bend and there should be a limitation in the bend. It cannot overbend and injure. So this knee bending is limited through the ligaments. The main ligament which is participating in this knee bending and knee extension is the cruciate ligaments. Very specifically, it is the anterior cruciate ligament, and which is commonly called as ACL, and the posterior cruciate ligament, which is called as PCL. And there are also lateral ligaments, which is called as a medial lateral ligaments and medial cruciate lateral ligaments and lateral cruciate ligaments, which is the MCL and LCL. So all these forms a very important ligament and enabling the knee to perform the flexion and extension. So this image shows the major muscle. The major muscle that connects your knee joint is your quadriceps femoris muscle. This muscle connects to the patella through the patellofemoral tendon, and that is going to connect with the tibia. This forms a shield structure for your kneecap, and in this particular image you can see the lateral collateral ligament LCL, and this one what is shown here is the MCL, which is the medial lateral collateral ligament. So you can see this is a side view which shows the connection of lateral collateral ligament. It is originating from the femur and it is connecting to the fibula here. Knee joint, its main function is for flexion and extension. Rotation and sliding movement is also involved. The femur moves on. So what happens is tibia stands like this, and femur, it glides over your tibia. So mostly when we are in contact with the ground, when the foot is in the contact with the ground, it forms a closed chain network, and when the movement has to be executed in your knee, it is a major role of the femur which has to bend, which has to glide, which has to rotate over the tibia. Okay, the beginning of the flexion, femur, you can see femur rotates laterally. So what it is rotates laterally. So what femur will rotate laterally towards the lateral side. It rotates and it relaxes the tension in the collateral ligament. So it just twists turn to the lateral side. Okay, during flexion the meniscus, lateral meniscus are pulled backward of the knee. So you just imagine my foot is put forward, so the femur is laterally twisted. This twisting will enable the ligaments, lateral collateral ligament to relax, and there is a gliding motion that is happening in the pulling from the back side. So it is twisted in the lateral way in the anterior plane, so there will be a pull from the posterior side, that is the back side of the knee. At maximum flexion, the PCL is pulled tight. Yes, when there is maximum flexion is happening, it is completely pulling. The posterior cruciate ligament is pulling the femur and preventing the femur from sliding completely over the tibia, which can end up in a fall. Yes. So knee extension is straightening. So the condyle of the femur, what is the condyle? The edge, the curved edge of the femur, it rolls, you can see, it rolls over the, so condyle will roll over, it will just roll over like this, it will roll over on the tibial condyle like a rocking chair. Yes, it will roll front and back. Okay, near the end of the extension, the medial femoral condyle. So there it was the lateral femoral condyle, here it is the medial femoral condyle, it slides backward. For flexion, the lateral femoral condyle slides laterally, here laterally and anteriorly, here the medial condyle will twist in the backward direction, and when it is pulled backward, the ACL ligament which is present in the front or the anterior side, it prevents the condyle or the femur from maximum turning towards the posterior direction, and it prevents. That is why we keep saying that this knee joint is also a stability joint. So the stabilization of the movement is complemented from the ACL and the PCL, the anterior cruciate ligament and the posterior cruciate ligament, and also with the support of the collateral ligaments, which helps as a braking system in the lateral sides. These movements are, this locking mechanism, how this gliding, rolling and twisting all happening in your knee is very well explained by a theory called as the screw home mechanism, which we will see in a separate lecture video, but here we are just focusing more on the structures and their basic functions and on that particular structure aspect. Collectively as a screw home mechanism we will see in the later sessions. So ligaments and tendons, I have kept telling about the ligaments from the very beginning. So I have to, in this particular slide, I wanted to point out the muscles that is contributing to the movement in your knee is the quadriceps femoris muscle. Yes, and this, because this is the muscle which is originating, this is called as the thigh muscle. Okay, and it is also very important, and it plays a very important role in the knee biomechanics, is it stabilizing the knee. So leg muscles are very essential component, and the entire health of your knee joint is depend upon the strength of your muscle. So we have to keep our leg muscles stronger. So muscles, tendons and ligaments, they all make up the form of the fibrous joint capsule. That is why from the very beginning I keep telling, knee is not just a simple hinge joint, but it is a fibrous joint with a complete encapsulation of muscle, tendons and ligaments. That is what is emphasized in this particular slide. This is what I wanted to tell from then. It is the how the ACL, anterior cruciate ligament and posterior cruciate ligament are connected. So this is an anterior view. This is an anterior view. And you can see the groove. This is the groove that accommodates your patella. And you can see the tibia, the meniscus in the tibia and the coronary ligaments in your tibia. From there you can see the ACL is originating from the anterior side and it is transversing to the posterior side of your femur. And you can see the PCL, it has originated from the posterior side and it comes and attaches to the lateral condyle region of your femur. So based on its origin and based on where it is inserting, these ligaments are called as the anterior ligament because it originates from the anterior side, and the other one is posterior ligament because it originates from the posterior side of your femur condyle. And cruciate, why we call it as cruciate, because they forms the X shape, and this X shape is very important for stabilizing the knee during the flexion and extension. So the entire knee unit is having a cushioning property because of the meniscus, and meniscus is plays a very major role in absorbing the shock. Because just imagine a person of heavy weight has to stand, walk, do all the activity like a thinner person. they are able to do it, they are able to do their day-to-day activity because their knee joint is supported with this meniscus, which is going to help as a shock absorber, which is going to absorb the entire load and transmit it to the ground. Though due to obesity, due to overweight, the health of these structures are highly affected, but still it is supporting the system. The main purpose of this meniscus is to carry down the weight, load and all the movements that is placed over it. Okay, meniscus, it comes from the Greek word and meniscos, which means crescent. So the meniscus are crescent shaped or C shaped, and the median meniscus is forming the larger surface, and this is I kept telling it is a fat pad. Your meniscus is a fat pad, and this meniscus plays a very crucial load in preventing injury, wear and peeling out of the bony tissue, and this meniscus plays a very essential role in locomotion. I repeatedly tell this. Particular image, it shows the meniscus. So you can see this is the ACL, anterior cruciate ligament, which starts from the anterior side and goes to the posterior side, and beneath that you can see the posterior ligament, and there is two C-shaped, horseshoe shaped structures you can see. They are the meniscus. They are the meniscus. The one to the lateral side is called as the lateral meniscus. The one to the medial side of the knee is called as the medial meniscus. Yes. So it's as mentioned earlier, it acts as a cushion. It provides comfort. It absorbs the shock, and the median meniscus is larger when compared to the lateral meniscus, and it is more C-shaped, and lateral meniscus are circular. So if you see, median meniscus are like this C-shaped, whereas lateral meniscus are like this. So this is the top view. So this is the median meniscus, this is the lateral meniscus. So the available surface area for articulation also changes, because you have large surface area for the median meniscus and limited surface area with the lateral meniscus. So as the movements, the three pairs of movements which I mentioned, the gliding, sliding, rolling activity all are executed over this surface, and this surface area plays a very vital role for the screw home mechanism, which we will be discussing later. So it is also having a very excellent lubrication mechanism. Since knee joint is one of the highly movable joint, it has got a greater support from the lubrication mechanism. It is also a synovial joint. So all, just imagine bones, meniscus, the cushioning effect, the lubrication, all together keeps your knee healthy. Today we have come to an end of the lecture about introduction to the biomechanics of knee, where we have just discussed about what is the structures that forms the knee, how movements are happening in the knee, and what is the significance of meniscus in terms of load distribution and shock absorption, and why knee is so important in stability when we do our day-to-day activity. In the later videos we will see how the screw home mechanism and the entire biomechanics and orthokinematics of knee is happening. Yes, till then, thank you.